Welcome. Today is October 10th, the World Mental Health Day. My name is Büşra Akgönül. I'm with ASAM, and I'm with the project for increasing awareness concerning psychosocial support and mental health for migrants and asylum seekers in Turkey. I'm a psychologist, and this project is being funded by the Ministry of Foreign Affairs from the Netherlands, and the target group is migrants, asylum seekers, and we are working to increase awareness concerning their mental health. My colleague is Işıl Aksoy, and Işıl, you can introduce yourself. Yes, my name is Işıl. I'm a clinical psychologist. Today, we are hosting a very valuable academic, Professor Okan Cem Çırakoğlu. He is a graduate from ODTÜ Psychology. He did his master's degree in clinical psychology, and he has a PhD in psychological consultancy and guidance. He has been working with civil society projects and asylum seekers since 2012. He is also the department head for psychology in Başkent University and the director of the Stress Management Center. Welcome, Professor. Thank you very much. It is a pleasure for me to be with yourselves. Let me begin by emphasizing the importance of today and underlining this year's theme. Then we will have questions to you, Professor. As you know, October 10th has been declared Mental Health Day for the world by the Federation, International Federation, and every year this issue is discussed and emphasized under different themes. As you know, this year the theme is about mental health for all because the inequalities in the world are increasing. Unfortunately, the rich are getting richer and the poor are getting poorer. And in the recent years, especially, these divides have increased and the inequalities in human rights, psychology, discrimination, everything is increasing, and this kind of environment is impacting the psychological health of people. In countries with lower income, people from 75 to 95% do not have access to mental health, unfortunately. We look at higher income countries and the picture is not so bright there as well. Unfortunately, mental health is not an investment priority, therefore gaps remain in this regard. Professor, when we have such a significant need and when this issue has such a significant impact on the quality of our lives, what do you think is the most important factor in this regard? Thank you very much. This is a very important, vital topic for any society. Citizens in these societies need to be functional. They need to be a part of their social life, economy, education. These are all very critical. However, this is a perspective, meaning that governments, states, they have a certain amount of budget and they have to distribute that along certain topics. Will they prioritize defense or education? That's a decision that is subject to the preferences of each country. And of course, psychological health is very important in general health perspectives. And for social governance, this needs to be prioritized. But of course, we need investment in that regard. You need to allocate staff for this, and so on. And for that, we citizens do not have too much to say. We don't have an impact on those decisions on a daily basis. And unfortunately, both in Western and Eastern societies, African countries, wherever you look in the world, people have a certain prejudice against psychological issues and psychological health services. People don't usually very easily go to psychologists, psychiatrists, because there is a certain cultural pressure because of that unfortunate prejudice, and that becomes a challenge as well. The services, access to services can be improved, of course. That is one thing we can do on one hand. Services can have better quality. People can get more of these services. That are certain areas that we can maybe have an impact on, but I would like to go back to something you said, and I would like to thank you for using that expression. Psychological health, that's what we refer to now, and unfortunately in Turkish we have a linguistic connotation about the word mental health, which refers to your spirit, and that's not what we're not talking about. We as scientists don't work on spiritual health. We talk about mental, psychological health, and psychiatric services are now changing definitions. We are not just talking about not having a disease, not having a problem. We are talking about the wellness of a person. And we are not just talking about treatment services. We need to think about, in all dimensions of the society, from civil society to higher government levels, we need to think about the wellness of people, and we have to allocate resources to making that happen. And I think that's a very important dimension in social government. We have to increase this emphasis so that we can actually overcome the prejudices as well. When we talk about prejudices, we mean the stigmatization, the discrimination, and unfortunately, all of these have a hindrance on the access to services as well. And this psychological health does not impact a person on a given period of time. It has a long-term effect from education to economy to family relations, and we have to remedy that. People's psychological health will allow everybody to be included in daily life in multiple dimensions. And what do you think we can do at an individual level or a social level to really increase what we are talking about? That's a really difficult question. It is a very elaborate question because we cannot change a social structure overnight, and we can't do it with just one intervention. This has to be done on a very elaborate process. For example, in Turkey, we have a lot of migrants. We have people who are under international protection in our country. And there is an amazing amount of these people. We can't even name the number specifically. And these are people who are already subject to discrimination. Although they have fled to a country because of humanitarian needs, people who are in that society already have a prejudice because they're afraid of losing their livelihood. They're afraid of losing their space. And therefore, this discrimination deepens, and that deepens even worse in lesser developed countries with lesser economical advantages. And people who are subject to that discrimination with all sorts of reasons, from the way they look, from where they came, and Everything you can think about in that sense are unfortunately under significant stress as a result of this. Psychological health services and access to that is among the numberless risks that they carry with themselves. And in general, in these circumstances, people, not just in our country, but all over the world, they choose to exclude themselves from environments that they will be discriminated. What does that result in? Ghettos. They choose to be with people that are similar to them. They will get support from there, and they will not be excluded. It's a very natural reflex, and we see this in Turkey as well. To be able to struggle with that, since the past, internationally, there have been certain interventions that have been designed. As you know, social psychology has an important amount of literature in this regard. But in the past, mostly it is said that inclusion is not very easy between the discriminated and the discriminating. We need resources to be able to do that. People need to feel comfortable. There can be certain campaigns, there can be certain specific interventions, but this doesn't seem to be the solution because the numbers are very high and they are beyond individual intervention. Therefore, we need more fundamental solutions. And in Turkey, maybe this may sound too ordinary, but I have to say that we need to think about education curricula, and we need to add things that promote inclusion into the education system. From very early on, children need to understand the importance of this. And in Turkey, we have a 12-year mandatory education. And this is actually a very important advantage. You take these children to school, they have to go to that environment for 12 years, and you need not just emphasize math or science and other issues in this regard. Topics such as discrimination, sexual orientations, everything should be considered so that these children in 10, 15 years may have a changed perspective. Everything we do right now, today, is more or less like patching a wound. And that's all I can say more or less about this issue at the moment. We really need to think hard. We need to take this topic into all sorts of dimensions, from landscape design to architecture to urbanization to transportation. We have to make this perspective sink in to all of those dimensions, and that requires a significant strategy, planning, and implementation. Yes, stigmatization, discrimination, exclusion, that's all very true. And I think something that is also very valid is about physical problems. For example, the World Health Organization says that more than 2 billion people have a disability in terms of vision, and that actually has an anxiety and depression attached to it. Think about those people and these people's access to psychological health services. When that doesn't happen, their lives are impacted very significantly. And I think that's why we need to underline the importance of psychosocial support within physical diseases. When we cannot disseminate this service, we cannot make people understand that this is as important as the physical disease that they are experiencing. What do you think we can do in that regard? Yes, what I can say is that in the Western medicine now, there's something that is being accepted that we have been discussing for maybe hundreds of years in philosophy: mind and body health perspective. This takes a human being as a whole, with the psychology, with the physiology and biology, and it says that this individual becomes functional when all of these systems are healthy and functioning together. It really doesn't matter if you are having gastrointestinal problems. You have psychological problems with it as well. And your relation with the system, your relationship with the doctor, your relationship with your own living environment, all have an impact on this illness that you are experiencing, and they all need to be taken as a whole. When we are targeting a certain service, we cannot do this alone. We need to have a perspective change in a senior level for a health service providing system. At the moment, we are physical illness focused perspective, and we don't include the other dimensions. And unfortunately, in a country with an 80 million population, a doctor has 100 people waiting in front of his door, and there we cannot expect the doctor to take the individual as a whole with the physical, psychological, and other aspects. That is just not possible. Therefore, I mean to say that, again, investment is important. Allocation of resources is important, not just for Turkish citizens, for any individual. We need to provide a system where there is a treatment that is provided by a group of people, by a team, and of course that's not easy. That requires significant planning and strategy, and that has to be included in the education of health service providers as well, so that everything can come together. Irrelevant to whoever is waiting in front of your door, the doctor needs to be able to take that person as an individual and provide multiple interventions, multiple guidance aspects. And as you may all understand, this requires a significant system change. The health system has to be designed for the access of all individuals with, of course, certain steps. For example, with a flu, I shouldn't be able to go to a university hospital with government insurance. There's a problem there, because the proper service needs to be provided to the proper individual in a proper dimension and at a proper level, because otherwise people with a heart disease are not able to get the proper service from the related experts, because then the systems are overburdened. We need to be able to look at the distribution of that burden as well. And once again, these are not issues that you and me can change overnight, but still we can emphasize them. And we can emphasize the importance of the distribution of budgets and resources and priorities. Yes, Professor, something you said is very important. Integrating psychological health perspectives into the education from very young ages to higher education. Because when people know that when they have chronic back pain and they don't have a physical reason for it, they should be able to think about the psychological dimension about that. Maybe think about what's happening to me to have this pain. And when they can have that perspective individually, then results will change, I believe. And I think that kind of perspective changes through education, as you said. Yes, we cannot, of course, sit around and wait for the system to change. We cannot lose time doing that. We have to understand our resources, of course, today. In the health system, we need to be able to provide the proper guidance and maybe start increasing this kind of staff group with psychologists, psychiatrists, because these people need time to provide services. Therefore, their numbers need to increase. And we can work on certain interventions that will increase the awareness in the society at a short term as well. And schools and local administrations can take part in that, which I believe is very important. Thank you, Professor. And you mentioned at the beginning of the importance of naming this service as a psychological health service. It's not just mental health or like spiritual health, like in Turkish. It's not just about those things, because when we name it as such, we miss out on the dimensions. Definitely, terminologies, expressions, most of the time have a very important impact on meaning. For example, a parent, they have a lot of stresses in Turkey. They're about social stresses, economical stresses, about skills, and this is about psychological health. And when that health is relieved on that parent, then the child has a better wellness. So those are all steps that are following each other. And if we think about the psychological health in this sense, then we can increase the resources. We cannot just think about this as a single illness or a single issue. They are all integrated, and curing one thing in one dimension does not provide the results that we are looking for. So that's something I believe we need to emphasize. Thank you very much, Professor. We talked about the importance of psychological health very importantly, I think, now, but I also believe we should emphasize the impact of COVID-19 and the global impact we have recently experienced. We, as you know, saw all around the world that this kind of situation was not something we were prepared for, and people experienced something that they could not foresee. There were a lot of anxieties, there were a lot of losses, there were a lot of sadnesses, there were a lot of social isolation, and this became a very complex problem. But looking at this from a Pollyanna perspective, can we say that maybe this kind of isolation could have provided an environment where people could have thought about their own psychological health? Well, what I say in this regard cannot be considered a scientific output. I think I can only share my own individual observations, and they're not based on data. I think it's very important where individuals began the pandemic from. If they were in a better position with better resources, that's something else. But if people were in conflict regions, for example, in the world, or they already had problems, their functionality had a negative impact. This can have a maybe double-edged impact. People in conflict areas may have come together more, but still their stresses increased more, and that created problems more. So, in modeling that, in my mind, I end up saying that your beginning point was important for the pandemic, just like everything else. If you were aware, if you had resources, if you were functional, then what happened to you in the pandemic could have had positive results. You could have improved yourself. Maybe, but if you already lacked resources, if you were already vulnerable, for example, think about a migrant family. They have economical problems. They are crowded in limited areas. They have anxieties for their future, for their children. They can't access health services. Then the pandemic restricts them even more. I don't think that kind of condition is going to result in a positive, improving result. In a trauma perspective, yes, traumas do have an improving dimension, but I don't think not on these people, because these people's stresses are increasing, and you cannot expect these people to regulate their functionalities properly under this much stress. Probably their dysfunctionalities increased. Probably violence increased, substance abuse increased in these families, in these groups of people, because these people are already just struggling to stay alive, and the pandemic is making life more difficult for them. Therefore, I cannot really paint a very positive picture. The profile of people we see in our country in terms of migrants, asylum seekers, they are more communal kind of people, and they do have a restriction on their resources, and they tend to have a more coming together attitude. And for them, we need to find urgent remedies. We need to do this very quickly, and that gives a responsibility to the government, all public institutions, very significantly. You talked about certain impacts, but there are so many other dimensions that we cannot even think of at the moment. We really have to work on this very elaborately. Children, future generations, how are they going to remember this? What kind of impact will they reflect to their lives from this? We don't know. Therefore, we have to deepen the work in this sense. We have to allocate resources to this, and we have to do that urgently. I don't think we're very successful in that regard, unfortunately. Hopefully, soon, management, government will be able to do that, look at the resource distribution, look at the inequalities there to remedy that, because that all comes much more apparent in restricting times. And this is not just about us or the pandemic. I remember the United States, in Mississippi, in the floods, all those things that happened. Of course, emergency interventions are not easy, but we have to work on it and channel our resources in this regard. Thank you very much, Professor. It is such a pleasure to talk to you always and to learn from you. This is all from me on my side. Işıl, do you have any other questions or contributions? No, thank you very much. Thank you, Professor. Thank you as well. Your work always provides an opportunity for us to voice ourselves. I'm sure many people will listen, and hopefully we will also reach out to people who should hear us. And lastly, what I would like to say is that our past, today, and future are not separate from each other. We need a time perspective. And whatever we do today, whatever we don't do today, is actually designing the future. That has been true all throughout history. And now, in this global crisis, we have to remember this much more significantly, and for the welfare of the society, we need to understand that short-term interventions are not what we are looking for. We need long-term, well-designed policies. And unfortunately, individuals don't have much to say in that regard. Our responsibility is quite limited in that regard. People who are designing the future need to understand this, and they need to work on this. Hopefully they will do that, and hopefully we will all be more well off, and we will have a world with less inequalities. Thank you very much. Thank you, Professor. Yes, and as you say, we are trying to do our parts in creating these environments to voice ourselves, the least we can do. Thank you very much, and thank you for being with us. Thank you.